I'm Dr Wendy Richardson. I'm Director of Public Health for Hull PCT and Hull City Council.
Wendy, thanks for your time this morning. Tell me about how you got involved with Making Every Contact Count.
We started actually as a public health workforce advisory group which was established by the Directors of Public Health Network for Yorkshire and Humber. And in many respects we started out by trying to find ourselves some key tasks to work on. We knew that we didn't want to just plan training courses or talk about continuing professional development and those sorts of things, and we felt as though we wanted to do something that would really grasp the essence of what public health tries to do, but to involve lots of different professionals in that. So I suppose what I'm saying is we weren't just about highfalutin training courses for those people that had been through, you know, sort of faculty registration. And that's really how it started out. And I think in a mad conversation one morning at the KC Stadium when we were having a bit of a time out, there are about 10 of us that have been stalwarts of this group, someone said, what we've really got to do when we're dealing with members of the public, patients, clients, whoever we interact with, and whoever our providers interact with, we just have to make sure that every contact with them counts. And I think it was at that stage that someone jumped up and put that down on a flip chart, and before you know it, we were talking about making every contact count, which then became MECC, and everybody knows what that means. So it was one of those kind of evolutionary, organic things that nobody can quite remember where that sprang from, but captured the essence of what we were trying to do. For me now, particularly as we're in our transition year between the NHS and local government, it kind of does what it says on the tin, as everybody likes to say now. It does actually mean that we make every contact count. Where we started from, and for those people that remember some of the conferences that we've done at Doncaster Racecourse, you know, we've had the scenario of man has heart attack, sits in wheelchair, going for you know, a scan, porter starts to push the chair, and our idea was that that can be quite a long walk, sitting in a lift for several minutes. We shouldn't waste that opportunity to say to that patient, because he would be a patient in those circumstances, now, you know, look, how do you think you got here, you know, and picking up on lifestyle issues, whether or not it's about weight management, smoking, use of alcohol. And what we wanted to do, where we started from, was giving that porter the skills required to start off those sorts of difficult conversations, and that was genuinely where we started. You can't just say to somebody, don't forget to mention when you're in the lift, do you smoke? That's a bit daft. There are techniques to introduce what can be quite sensitive subjects, and we also wanted to give that porter some recognition for maybe a training course and a framework, you know, that they'd been able to, you know, pass. That, of course, in our transition year becomes even more important, because as we move over to local government, we don't just talk about patients. We never have done in public health. We talk about members of the public, we talk about customers, we talk about clients. And one of the things that I think the group, who we're still very interested in developing MECC, are interested in is how we can take that into new territories. So can we give the same skill set and the same framework to someone that, say, works in a customer service centre for a local authority, maybe a rent office, where someone might come in, want to talk about some rent issues or some council house issues, and in the course of that interaction you might find that someone has a cough. Is it because of where they're living? Is it because actually they are developing some problems, whether it's COPD or, you know, for goodness sake, lung cancer, that someone can recognise and has the techniques to start to introduce that into a conversation in a comfortable way. And I have to say there is a technique to doing it, because I'm not good at it. So you know, I've always been really clear that my standpoint with a smoker is, you are so stupid for doing this. How many times do I have to tell you this is just going to kill you? And of course you get nowhere. And when I watch people who are well versed in these techniques around behaviour change, you can just see how they start to develop a relationship and introduce this at a really comfortable level, and then leave it for a bit, and then if they know they're going to see that person again, you know, introduce it again and get the results. And what we want to do is to start to spread that away from NHS settings, talking about patients, to other sorts of settings.
Areas beyond health, do you think that we can use MECC in there?
I think you're absolutely right. And one of the things that I'm finding when I'm in my local authority, where I've always been a joint appointment, but obviously now going to be working for them, along with my team. When they say, well, we thought we knew what you did before, you kind of managed outbreaks and, you know, those sorts of high-tech public health things. But what are you going to do when you get across here? I actually found that MECC is a really, really good example, because you can actually start to talk about giving other local authority employees a skill set that they can use across a whole range of areas. Actually we want to get a health message across. So I've mentioned, you know, whether it's housing offices, whether it's at children's centres, whether it's in services that we might be commissioning through care homes for older people. It is just making every contact count, and I genuinely think the sky's the limit. You know, I mean, whether or not we could ever progress this into, you know, private sector settings. When you think about some of the really big employers, and I have a background in the private sector, working for big blue chip companies, there is usually a programme where employees are encouraged to do something. They get a skill set and they can use it either internally or externally in the community. And if we're talking about wanting to maintain a healthy workforce, for me the next stage would be to have people with a skill set working in companies, whether it's manufacturing or service providers, who are acting as health advocates in the workplace and doing those behaviour change models that many of us have known about and used for years and years and years. It's always been a big dilemma in the NHS and for NHS employees that there is an expectation that you will be, you know, a paragon of virtue and an exemplar of good health, and, you know, we know that many of us that work in the NHS, you know, have our own foibles in terms of you know, lifestyle and lifestyle choices, and I'm trying desperately to avoid using the example of, you know, nurses seen behind of the kind of the power substation on a site, you know, having a quick fag, and what that means. And, you know, there is an element of, you know, physician heal thyself, and it's always been a really difficult debate in the health service, and one that we've skirted around, and I think we are still skirting around. But I do think there is a huge responsibility on an employer, you know, to start internally. If you think about a local authority, which, you know, depending on the size of the patch, but can go anything from, you know, 10,000 to 20-odd thousand employees, but it's always in the thousands when you're talking about unitaries, then you can have some significant effects. We've actually done some work here locally, through some funding we got from the British Heart Foundation, some significant funding, where we've used techniques of making every contact count with a private petrol company, local company, but known nationally, but still with a base in the city. And we actually had the MD of that company talking to us at one of our kind of milestone events for the British Heart Foundation work that we're doing, the Hearty Lives work. And when you actually get the MD spending a whole morning sitting in the Guildhall telling other people from the private and public sector about how successful this has been, and basically he had about half a dozen guys, they were tanker drivers, went through the training about smoking, weight management, small changes you could make in your own life. You were not going to be this paragon of virtue, you were not going to be Mr. or Miss or Mrs. Perfect, but you were just going to have pick something to change and see it through. And the difference that they found, not only in that a couple of the lads lost a bit of weight, a couple of the lads joined or started, I think, a five-side football team, but actually there was, he told me over lunch that there was a bit of a warm glow around the place, that just for the first 20 minutes of a shift, a bit of time was given back by the company to have these sessions. So I think they started at kind of 7:30 in the morning. The lads had this bit of a briefing, had a bit of a chat, caught up on progress, how they were all doing, and that obviously meant a lot to them, that the company had just given that little bit of time. They were giving some of their own time, but the company had done that as well. So I think there's a lot to be learned from, it's not just the message that you give out, it's the fact that actually somebody's putting something into place. That's where I've always come from. I don't like to kind of, you know, say that too frequently, because it can sound, well, it can either sound trite in that, you know, you're all fit, so you turn up to work every day and you're never late, and, you know, that doesn't always happen. But I think there is something about a feeling of well-being that comes from two aspects of what you can do with making every contact count. One is that you actually might feel more well because you might not be carrying as much weight, you might have given as much, all the things, you might be drinking as much. But I think there's also something about valuing something that's been put in place by an employer that actually think, well, actually they don't give two hopes whether or not I'm feeling like that. And then the natural outcome is, I think people are more committed to to the work that they're doing, and I think that goes for any sort of job. It isn't just about a particular level or a particular type of job. I think the other thing that we mustn't forget as well is that there's a lot to be gained from having just a few individuals in an organisation who have maybe stepped forward and said, I'd like to do this training or personal development, however they view it, because I think they get a lot out of it. And the people that I've seen that have been through the framework, got themselves on the training course, been back and revisited them, how have I got myself up to the next level, and actually a desire to get up to the next level. For many of those people, it's the first taste of training. It's the first taste of, I can actually understand this stuff and I can do something with it. And unlike me, maybe I am one of those people that has that natural aptitude to introduce these sorts of subjects to people and get somewhere with it. And I don't think you can dismiss that if you've got these seeds in a workforce, the big impact that has.
Ambition for MECC then in the future?
Well, I don't want it to be forgotten. It's always really difficult in a transition year. There's so much to do that you think, well, that's joggling along on its own. I think there are very few things that will joggle along on their own. Every pot needs a stir, and I think MECC is one of those things. And with other members of the group, we have been a sort of a 10-15 strong band for a number of years, and everybody's committed to doing that. I mean, there are websites being developed which look really, really good to me, and all sorts of new ideas for keeping this thing going. And I think in many respects, I think the ambition is quite simple. It is to keep it going. I mean, I'm not going to say, well, I'd like it in every blue chip company and every local authority, by 2015, because it might be called something else by then. But I think it's just the concept. I think that we inevitably work in silos, all of us, and can be the world's worst of, well, that's not public health, that's public health. But I think it's just to keep that pot stirring, that whatever anybody calls it, we are making sure that whenever we interact with other people, that there is a technique that some people can use to get the best out of that interaction. And I think the other thing for me that's really important about the MECC that we've developed is that it is seen as an entity with some standards, and I think that's one of the things that we've been maybe a bit precious about, but I'm not going to be embarrassed about that we could have just said, well, let's make every contact count, and let's just stand in a lift and interfere with somebody and say, well, I don't think you should be smelling a cigarette smoke, you obviously smoke and you're a bit daft. We right from the beginning knew that there had to be a framework. There were different levels that you could go through. There was a competency that framework that you had to ensure that you were reaching, and I think that's one of the other things. So for me, it's don't lose it. Don't mind if other people call it different things, but for me and for us, I want to maintain just a little bit of preciousness around making every contact count and the frameworks and the standards that we've set up, so that if somebody knows that they're buying into our way of doing things, that they feel as though they're going to be supported through that training, through that learning, and making sure that they've got somewhere to go with issues that they want to kind of unpack or learn more about. So I think that's the ambition for me. Keep it going, but make sure that standard is maintained.